So I'm just going to go over a little bit what we're doing for surveillance and what is happening in Manitoba. But the big points I'd like you to take home is that it has been a huge team effort and involved a lot of people, and that we've had a lot of open communication among the group. That has been very helpful for coming up with new ideas and solutions. We've also had some opportunities to take some data that was out there and use just a little bit of money to and a few pigs to look more closely at the situation. And at this point, now that I'm finally getting a larger amount of data in, I have just barely scratched the surface on what we can do. So what is disease surveillance? It is actually a lot more to do with data collection and analysis. And you want to have a large amount of data to really do proper surveillance. Most of this data is going to come from the PCR testing, occasionally ELISA and bacteriology results, but it depends on which disease you're looking at. The more important aspect that we don't always get collected is the farm data, in particular the outcome data of what's happening after the incident occurs, and then the meteorological data is sometimes collected. But in order for this kind of surveillance to be effective, you really need to make sure that there's some standardization of the reporting of this data, and that's been probably the greatest roadblock that we've come into. And it needs to be available. It needs to be publicly available, not just to select people. So the things that we'd like to do with this data is monitor the changes in disease patterns, and I've been looking more at what's going on with influenza in Canada and evaluate what we're doing for control and what it is actually becoming effective or is just not effective at all. The identification of risk factors is definitely key to coming up with an effective solution. And then allocation of resources. If you don't have resources, especially government resources, available, it's really hard to do the surveillance in a coordinated effort. And my example of that is the Zika virus problem that has been occurred this last year in the United States. So the CDC went to the president, asked for $2 billion, and he put a bill up. Then Congress decided, well, they really don't need that much. We'll give them $1.1 billion. And then it went to the Senate, and it was vacation time. So they dropped the ball. So now the CDC has to do whatever it can with the resources that they have currently available, and they've had to move some things around. So the next example would be the PED response in Canada. In particular, in Manitoba, the resources available are coming from the Manitoba government and the producers as well. So we had PED-free status in Manitoba for a while, and then this last spring, early summer, we had the first outbreak in a while. And then just last week, we had the second outbreak. After the first break with PED, the government person on one of our phone calls told us that he's already on the cleanup process and testing around that area because we want to monitor all the farms around that farm that broke. They've already used up all the money for 2016, and they were dipping into 2017, and I'm curious to find out how much further into 2017 or 2018 they had to go with this newest break. The other issue is having an archive, and definitely a publicly available archive, so that researchers can use the information as well. The caveat I have, of course, is it's the quality of the data that will determine some of the uses. I do active surveillance, and from time to time a farm doesn't turn in their sample for that month, or they forget to put anything on the paperwork. I get a blank sheet of paper that comes with the samples, and I have to call them up, or their vet has to harangue them until they give me the information. But I don't always have time to get all the data, so that sometimes we have gaps in our data. So I do both active and passive surveillance. Active is when you're actively going out and looking for samples. This can be done. A lot of production systems are doing the active surveillance on their own, just like the last presentation. They're looking for multiple diseases on a regular basis, and that can be even as little as quarterly can count for something. I'm doing it in a research project scenario, so I'm actually sending out kits and providing mailing, packaging, and ice packs and everything so they can send me the samples every month. And I'm not targeting specifically sick animals, because with flu we know the clinically presenting animals that are coughing are often the ones that aren't shedding. I'm actually trying to find out what is on the farm in the apparently healthy animals as well. With passive surveillance, that's more when there's an outbreak when you go in. So these tend to be the diagnostic lab samples that get forwarded to me. So it's regular versus as needed sampling. And the key to this is you have to know the disease and the farm and how the disease is working on that farm to be sampling the right animals. So the example just before us, if you're not using a vaccine, you're probably going to find it in younger animals. If you are using a vaccine that is somewhat effective, you're going to have to go with older animals. So this is the number one question I get asked by practitioners. I'm regularly asked who to sample and what swabs do I use to sample. So if I'm dealing with a farm that doesn't appear to be under control, whether or not they are using a vaccine, I usually start with pigs that are 14 to 24 days old. This is where I've gotten the best success at getting positive samples that I can get viral isolates out of. Other farms have been able to do their sampling with the processing at weaning and had just as good success with that. So with some systems, it's been easier for them to just process at weaning. And I usually just start with 10 nasal swabs. If there's lower prevalence, then I up it to 20. But for the most part, especially when I'm doing my surveillance, I'm just doing 10 swabs in suckling piglets. So the next scenario is you have a vaccine that's somewhat working or working very well. And that's when I see it peaking in the nursery. So usually, most common it's the 6-week-olds, but it can be up to 8-week-olds, depending on how that vaccine antigen works. Sometimes I have seen farms where it doesn't peak until 8 weeks. So when I'm looking post vaccine being introduced to a farm, what I'm recommending that the veterinarian do is go in on a monthly or every other month basis after they've put a new vaccine in and do piglets, 10 swabs, and then oral fluids, 6 samples. 3 samples at 6 weeks, 3 samples at 8 weeks. And then by 2 to 4 weeks after, I'm also asking them for 2 piglets in each of those pens, they're taking oral fluids to collect 2 nasal swabs. So that's 10 to 12 piglets that are 6 to 8 weeks old. And that way, with the oral fluids, I really cannot stress enough that it's really hard to isolate virus out of oral fluids. It's also very hard to sequence virus out of oral fluids because of all the contamination in that. But we can detect virus. So it's better if you want to isolate and be able to characterize the virus to have a nasal swab. The next question is always, what swabs do I use? So for the most part, I just use the culture swabs. The problem with those is sometimes they come out with blood on them if you go too deep. It is a good thing to go deep in the nose to get the flu, but if it's compromising your sample with blood, I will tell you it's, for the most part, we've started to look at this, we're not isolating virus. Something in the blood is killing the virus on those samples, so we can detect it, but we can't isolate it. So I will tell people, get it in so that the nylon tip is past the nostril, so only a couple centimeters, if they're really shedding virus, is absolutely necessary. So if they're not comfortable, because most of my samples are producer collected. If they're not comfortable, they can go in just a few centimeters and get just as good of a sample. The other option is a lot of people like the mini flock swabs on the young pigs. Do not use a mini flock swab with 3 mils of viral transport media. That is one of the more commonly sold products, but you can get it with 1 mil of media. It will dilute the virus too much, and it will be hard for us to both detect it by PCR and isolate it. So if you're using a regular sized flock swab, you can use the 3 mil, and that's usually what I use on sows, is the regular flock swab. So that is my segue into the most common questions being asked of me. So flu surveillance in the United States has been led by the USDA since 2009. This has been passive surveillance, primarily through state labs, and they have provided funding for most of the steps. Unfortunately, as it goes forward, they had to rejig it slightly, and so they are still going to cover the hemagglutinin, neuraminidase, and matrix sequencing, and those will continue to go into GenBank after they're sequenced so that they will still be publicly available. And isolates get forwarded for archiving, so researchers can use them at the USDA, and they also do whole genome. So flu surveillance in Canada, we have no national program at this point. It is provincial laboratories and provincial funding that is doing most of the surveillance for flu. In Ontario, they have some larger, more national funding as well as provincial funding. So they are screening, just like with the USDA program, virus isolation, subtyping, and then they're sequencing HA immediately, and then they forward the isolates to the CFIA, which is actually doing the whole genome sequencing. This has been going since 2012. We have not seen very much of that data yet, so I'm very interested to see what will come from that. The Quebec, the University of Montreal, a researcher has some funding, and they've done some whole genome work in Quebec, but it was very limited. And then there's Western Canada, which is me and my laboratory. And so I've been doing active and passive surveillance since, well, I tried to start in 2011, but more samples came 2012 to 2013. So it was building a lab and getting funding took a little bit of time, but we're at the point where we're fully functioning and supported by both the governments of Alberta and Saskatchewan. And we have connections through Prairie Diagnostic Services, which is the Saskatchewan Provincial Laboratory, as well as my collaborations at University of Minnesota. A lot of the samples from Manitoba go through the University of Minnesota lab. So to have that connection, we can actually harmonize and get all of our data collected together that way. So as far as communicating, one of the key ideas is that we have both private practice veterinarians, experts, the provincial representatives, as well as diagnosticians, all on the same phone calls to discuss what's going on. And that's for all diseases in pigs. So it can be more, it's generally more than flu, but quite often flu is an issue, especially in Western Canada. So all of us sign a privacy policy that we will not disclose specific information, and there is a report that comes out that is generated for both the veterinarians in our region and the producers. And we also have a quarterly phone call with the other groups that are covering the rest of Canada. So both Quebec and Ontario have groups that already had been discussing prior to the start of 2012 when CSHIN began, which is the Canadian Health Intelligence Network. And there's also information that is being collected from the diagnostic labs, but we're having issues that the diagnostic labs are reporting diseases differently from each other, and to get that harmonized has been an issue. So some labs are reporting number of positive samples without saying how many samples they tested, and some are just reporting a percentage. Each of the practitioners get to do a clinical impression survey each quarter. So this is just an example of it on the right. And what is asked is how many sows they work with, where they're located, and then for each disease that we survey, they say if they never see it, it's rare, or it's uncommon, or very prevalent. And then they also say whether it's increased, decreased, or stayed the same over the last quarter from previous quarters. And then they have an opportunity to put comments on the side. So at the bottom, I've put from the last call the comments from the Quebec group on influenza, and it just shows all their numbers and the comments that they had. So we get to see all of the different reports for the regions, because there is some difference in what diseases are prevalent. And what we have found is that about 40 to 45% of veterinarians responding to this survey ends up representing about 90% of all the pigs in Canada. So this is my screenshot from the last conference call. I've whited out everyone else that's on the call, but you can see that there's this graph here in the middle. And what that is showing is if there are 3 dots above the red line, it's a signal. If it's above the dashed line, it's also a signal. So whenever they read a signal, it's something that we need to discuss. And these are examples of the reports that come out of those. So it could be on something as simple as parasites or just the general impression. So the people that don't participate in the call, as far as the veterinarians, get to get the gist of it afterward. So now I'm going to change gears a little and talk about the Manitoba experience. And so I'm in Saskatchewan, but most of the pigs are in the west in Manitoba, and there are several veterinarians that get together and discuss on a regular basis what's going on in their area. So this is just an overview of production in Canada, and almost half of the production is in Western Canada, but most of it is in Manitoba, just as a reference. And here is the exports from Manitoba every year to mostly the Midwest area. So 3 million pigs leave Canada and come to mostly Minnesota and Iowa. So 2 million out of 3 million pigs go to Iowa, and almost 1 million of them come to Minnesota every year. There were some challenges in Manitoba, some adverse market conditions between 2008 and 2012. Most of it started with the country of origin labeling laws, and then the pandemic hit right after that. And you can see the big dip on the left graph, and that's right when that happened. And the Manitoba herd is just starting to get back up to the same production levels it was before that. But just to point out, in 2015, that 80% of the pigs being exported were iso-weaned pigs. So these are recently weaned pigs that are going across the border for the most part. And where is most of the production? At the end of that arrow is where some people call it Hog Alley. It's near Winnipeg. And for those of you who are geographically challenged, it's north of Fargo and the Red River Valley that floods every year. So that's kind of where all the pigs are coming from. And there's a small group of veterinarians that deal with over 25% of all the Canadian pigs and in that region. So they deal a lot with exporting of the pigs. And it's represented mostly by 3 large production systems that are doing a lot of that work. So they have regular meetings, and from time to time they invite myself and Marie to discuss the flu situation in their region. So this has been a learning experience for all of us involved, and we have learned a little bit more about the trends that we see with influenza, but we still need to go much deeper. Some of the risk factors need to be explored a little bit further. So to understand and eliminate risk, you have to know what all of the risks are, obviously. We also need better measurements of success. So one of the presentations earlier this morning had average daily gain. I've always thought, oh, well, why don't we measure average daily gain? And that might be why I wouldn't bother with it if it's too variable and doesn't give us what we want. But we need to have some sort of measurement on the farm so that both the producer and the vet know that you are getting a result from the vaccine, other than the anecdotal, yeah, everyone feels, they seem to be doing better, they're coughing less. I'd like something a little more firm to know that what we're doing is the best. And the bigger question is, how do we know we eradicated it? So if you don't find the flu for 2 years, that's probably a good idea you don't have it. I'm usually pretty hopeful if I don't find it for 6 months, but I know that little bugger can hide somewhere and then all of a sudden rear its ugly head come January. So I'm always cautiously optimistic whenever I think we've eliminated flu from a farm. So we're also looking closer at how we're monitoring the influenza and whether we have the same flu or if that flu is changing. We've had a lot of issues with when we use autogenous vaccines. Within 6 to 9 months, the virus is changing just enough that the vaccine doesn't work anymore, and then we have to go and update it again and again and again. So we just feel like we're chasing it. And also, it's not just those changes. We really have 3 outcomes that we're looking at with influenza. We either get rid of it, it changes antigenically, or it disappears and another one comes in that just was waiting, hiding underneath it. So those are some of the bigger problems we're running into. What we're looking forward to is we really would like to be able to combine the data and share it more openly amongst a limited group, but also protect it. One of the issues we've run into is the servers are located in the United States, and it is an issue in Canada to have your data on a server in the United States because there are concerns that some government agency is going to demand access to it and be able to, if we link it to data from the farm, be able to track it back. And so we just don't want to have that. So getting some sort of database going that we feel comfortable with, that is protected, that has limited access, is something we're still working on. And we're going to continue with our field-based projects because that data is a little, it's more practical, and we can try all we want in the lab, and until we get it working well in the field, that's when we can really feel like we've been successful. And then we're also doing more vaccine testing, new types of technology. What we have found is similar to what Bob talked about. Closing the herd seems to be helping. Certainly, if we treat it like PRRS, we do find that there is more success when you bring in a vaccine program. But we'd like to be able to get more hard data, and there probably is the data out there. We just need to gather it from all the individual sources to actually look at it and see, do our statistics on it and see if that is making a change. So hopefully you got the message, and it really is a community up there, and we need that community if we're going to make change.